Hello and welcome. My name is Susan Rice and I'm a clinical educator for UI Medical. I'm here today to introduce you to our QuickChange Wrap. What is the QuickChange Wrap? Well, the QuickChange is a new non-invasive urine management device that we genuinely believe is going to have a wonderful impact on the effort and time involved with managing your patient or resident's urine needs. You'll see that it takes as little as 60 seconds to change a wrap, minimizing contact with the patient without any indwelling items or without requiring the usual lifting and rolling and wipes and barrier creams normally associated with pads and briefs. In this video, I'll be showing you the different ways to apply the wrap to best address your patient's situations and needs. I'm also going to be covering a few tips and tricks, and then I'll walk through some of the most frequently asked questions. As I mentioned, the QuickChange Wrap, or penile or incontinence wrap, is a new type of urine management device. It's used to replace adult diapers and briefs, as well as urinary catheters, though wraps can also be used in conjunction with them. So it shouldn't be surprising that quick changes are used across the entire healthcare spectrum, from acute care hospitals to long-term care facilities, from skilled nursing to home health and hospice. Let's take a look at a graphic. Quick changes fold around a male patient's penis and absorb urine as soon as it is voided, keeping the urine immediately contained and off the skin. By keeping urine off the skin, wraps have been clinically shown to prevent certain pressure injuries and to prevent incontinence-associated dermatitis and MASD. And by replacing catheters, quick changes reduce, if not wholly prevent, CAUDI events. The wraps are extremely flexible and are great in difficult situations like retracted or indwelling penises, within large scrotums, and with bariatric patients, requiring only minor tweaks in the folding process. We'll cover each of these situations in this video. Let's talk some details of the QuickChange Wrap. The pattern, or printed side, is your breathable and waterproof side. This is what will go against your patient's skin. The white side is your absorbent side, and you'll notice a hook and loop Velcro on the straight flap that holds the wrap closed by attaching to any part of the printed side. Inside each wrap are super absorbent polymer beads that absorb liquid and turn into a gel, locking in the liquid and moisture. This allows the top sheet against your patient's skin to be dry to the touch in under 2 minutes. The quick changes hold about 500 cc's of urine, and dry the wraps weigh 31 grams each. One size fits all, and the quick change is latex free. An important part of the quick changes is to discuss the patient profile. Now we have 2 main profiles, incontinent men and continent men, and each requires a different approach. Your first and easiest profile is either incontinent men of any age or men 60 and over, basically men with a low pressure urine stream. One wrap will work perfectly for these men. Your second profile is a fully continent man or at least a younger man, basically men with a high pressure stream. For these high pressure patients, I'll show you a technique using 2 wraps. We do want to warn you, your mileage may vary with this technique. The wraps are also best used on non- or minimally ambulatory men, bedbound, chairbound, or with only light ambulation, like walking between a bed and bathroom, or maybe down a hall with an IV pole, or in rehab. And of course, always follow your facility's guidelines and practices. If in the future you ever just need to touch up on something specific, for example, how to apply a wrap on a bariatric patient, look for short clips on our website or our YouTube channel that deal specifically with the application you need to review. We are constantly updating our videos and adding new content to cover additional situations. So please, check back regularly for new posts. So, let's get started. We'll start with a standard patient, which basically means that there's a shaft to work with, and we'll start with our primary profile of an incontinent patient with low urine pressure using 1 wrap. Now for demonstration purposes, this is our mannequin, and these are the legs of our male. In almost all applications, the wrap will be placed so the tabs align with the legs to legs. Place the wrap on the patient's abdomen with the white absorbent side up. Make sure the round edge is towards the head of the body and the 2 flaps are towards the legs. Slide the wrap down so that the inner ring is as low towards the base of the shaft as possible. Adjust the penis so that it rests in the middle of the wrap. The tip of the penis should not be closer than 2 to 3 inches from the top. If it is, just adjust the wrap by sliding up. In this case, we have a good fit. Fold the pointed flap diagonally across and over the shaft of the penis at a 45-degree angle. Make sure the top edges are aligned. Now take the other flap and fold it up and over the first, pulling it up and to the right, making sure there is a snug, semi-tight fit around the base of the penis to prevent possible leakage down the shaft. Again, make sure the top round edges match up. As you can see, a flat fan shape is the result. So with 2 fingers, give the hook fastener and the inner flap a good pinch to make sure there's a good grip between the 2 surfaces. Remember, the top rounded side is not sealed or closed so that heat and moisture can escape and so that air can circulate. The 360-degree fan shape ensures that urine is trapped within the wrap and doesn't migrate between or over the legs or pool under the buttocks. These are the key features that will help drive down the dermatitis, the MASDs, the IADs. That's it for the standard application. So let's talk about some tips. Make sure to pinch the Velcro good and hard to the underside. A simple push with the finger may not be good enough to get a good grip between the 2 surfaces. When you're repositioning or turning your patient on his side, please consider changing the patient first. The weight of a soiled wrap will likely pull and become uncomfortable for your patient. If the patient sleeps a lot on his side, slide a second wrap under the first and attach the fastener from the second wrap to the folded one. The traction of the second wrap should keep both in place. If you have a patient with severe spasms, use mesh briefs or a jersey-fitted underwear or something similar to hold the wrap in place. Let's move on to our second profile that uses 2 wraps. You may have a patient that you really want to use quick changes on, but he doesn't quite fit the primary profile. Maybe he has a medium pressure stream. Or he's a new patient and you're not familiar with his profile. Maybe he's on Lasix or diuretics and you're afraid that he'll void more than 500 cc's in one episode. Maybe you're just looking to never use a Foley catheter again. Well, here are 2 modified methods we can recommend for this secondary profile. Both start with the standard wrap above. Method 1 is for a medium urine pressure patient. After folding the wrap, simply add 1 to 3 pieces of tape to the round part of the wrap to somewhat close the top. This should knock a stream back down while allowing air to circulate. This is a very effective approach. Method 2 is a bit more foolproof. Use a second wrap to close off most of the top and absorb any overflow. Let's demonstrate. I find it easier if you start with 2 wraps, one on top of the other. Fold the first quick change wrap in a standard wrap. Line up the second wrap about halfway down the first and make sure the middle's aligned. Pull the center down and fold across the first wrap. Bring the straight flap up and give it a quick pinch to secure. Make sure you have a tight fold and grip. You now have a barrier across the majority of the wrap that should prevent urine from escaping while still leaving a large opening for heat and moisture to escape. For your patients and residents with retracted or indwelling penises, you will fold the wrap around the scrotum as well as the penis in order to secure the wrap. We suggest you apply either zinc spray or barrier cream on the scrotum, as the scrotum will be in the wrap. Place the wrap on the patient's abdomen with the white absorbent side up. Again, make sure the round edge is towards the head of the body and the 2 flaps are towards the legs. Legs to legs. Slide the wrap down so that the inner ring is as low towards the base of the shaft as possible, or if totally retracted, the tip of the penis. Slide the pointed flap between the thigh and scrotum and then scoop up the entire scrotum, lifting upwards. Make sure the folded flap is as close to a 45-degree angle as possible. Then fold the second side over, slightly pulling upwards like last time. You want to make sure there's a snug, semi-tight fit at the base of the genitals to prevent possible leakage. Then make sure to pinch the hook fastener and inner flap together to get good adhesion. You're not quite going to get a perfect flat fan shape like with a standard application, as there's more volume inside the quick change. And again, the top remains open to allow heat and moisture to escape. Now let's review some tips. It's really important to make sure that you give that Velcro a really good pinch. And when repositioning a patient or turning him on his side, consider changing him first, as a soiled wrap can pull away from the patient. You can place a second wrap underneath to hold a wrap in place if he is spending a lot of time on his side. You can also use mesh briefs or underwear for patients with severe spasms. For your patients with a heavy flow or high urine pressure, or again, if you just want to stay away from catheters, you can take the wrap or use a second wrap as with the standard application. For your obese patients, there is most likely a pannus or large belly covering the genitals. Because of this, using a wrap in the traditional method isn't possible. In this application, we'll be using 2 wraps. And although it's not required, but it would be helpful if there were 2 caregivers involved. First, cover up the Velcro hooks so that it doesn't abrade the patient's skin. You're just turning the Velcro hooks into the absorbent side of the wrap. Cover the Velcro on both wraps. Then your helper is going to come in and move the belly away from the area around the genitals so that the genital area is exposed. The first wrap is going to be brought as far underneath the scrotum as possible. Then tuck the QuickChange gently in between the legs. This is going to catch any runoff and it will help with skin integrity on the patient's legs. Then take the second wrap and create a circle. Now, while the belly is up and away from the genitals, you're going to fold the second wrap over the source of the urine so the absorbent part is centered right up against the source of the urine. And then imagine my hands are the pannus coming back down over the top and resting on top of the QuickChange, holding it down in place. This approach also will keep any moisture or urine from going up and under the pannus and causing any further moisture or fungal type of irritation. The approach with 2 wraps is also very useful for patients where the penis is buried under subcutaneous fat and nothing is really available at all. The QuickChange wraps are also a great product in case of enlarged scrotums and scrotal edema. Far more effective than the typical sheets and towels approach used and without any of the cleaning agents like bleach that can further irritate this sensitive skin. For edemas, the QuickChange is wrapped around the penis and scrotum in an open cone bowl shape. Besides absorbing the urine, this approach will be doing 2 additional things. We're capturing any perspiration, excretion, or seepage from the swollen scrotum, which is usually red, raw, painful, and sensitive to moisture. And you're preventing the scrotum from migrating down in between the legs. Let's walk through our 2 methods. We'll start with a medium or large edema, about the size of a large grapefruit. Make sure you treat the underside of the scrotum with any type of barrier cream or zinc spray that you have, or whatever your protocol is for protecting that sensitive skin from urine. We're going to take 2 QuickChange wraps and create 1 large wrap by connecting the 2 ends using the Velcro tabs. Don't worry about the location at first. The Velcro will go anywhere on the backing, and we're going to be adjusting the size of the QuickChange to accommodate your patient. So, make your double-sized wrap and place it on your patient's abdomen, flipping the 2 legs upwards to get them out of the way and help you slide the wrap gently into place. Gently lift up the scrotum, separating it from the legs, while taking the pointed side and bringing it under between the scrotum and the legs. Now take the straight Velcro side and using the pointed side as a lever, you're going to pull them together slightly and attach the 2 together. Make sure this attachment is secure. Now you have a circular wrap. To make it as comfortable and effective as possible, you've got to tighten the sides. You won't be able to do this from the bottom, so take the 2 ends towards the head and pull them together towards each other. You'll see that the wrap becomes a bowl, as you can see from this angle. To recap, we are doing 3 things here. We're capturing urine on the top because the penis is resting against the wrap. We're capturing any perspiration or seepage from the swollen scrotum. And we're preventing the scrotum from migrating back down in between the legs. If you're concerned about your patient's linens or clothes, just attach another wrap over the top so you can keep that circulation going without fear of any urine coming over the top. Make sure to give it a good pinch. If the edema is closer to the size of an orange, only 1 wrap is required. Place the wrap on the abdomen with the white absorbent side up. Again, make sure the round edge is towards the head of the body and that the two flaps are towards the legs. Legs to legs. Slide the wrap down so that the inner ring is as low towards the base of the shaft as possible, or if totally retracted, the tip of the penis. Gently lift the scrotum up, separating it from the legs. Using the pointed side as a lever, you're going to place it under the scrotum. Then fold the second side over slightly, pulling upwards. Like last time, you want to make sure that there's a snug, semi-tight fit at the base of the genitals to prevent possible leakage. Then make sure to pinch the hook fastener and inner flap together to get good adhesion. We typically get asked the following questions by staff in professional facilities. When should the quick changes be changed? If the wrap is soiled, it should be changed. Most facilities are checking or moving their patients every 2 hours and changing when necessary. How many wraps does a patient require daily? On average, a patient will go through 5 to 6 wraps in a 24-hour period. How do I order the quick changes? Depending on your facility's protocol, reach out to material management, supply chain, or your nurse manager. Are the quick change wraps reusable or single-use disposable? The wraps are single-use disposable and should be disposed of in the same manner as an adult disposable brief or underpad. How do we calculate I's and O's? I's and O's can be determined in the same fashion as in the pediatric units. A plastic bag and dry quick change wrap are weighed together on a scale. Then the soil wrap is placed in the same bag. Calibrate your scale to reflect the original dry weight and place the soil wrap in a bag on scale to establish final output. Can the quick changes be used in concert with the catheter? Yes. If you have a patient with an ill-fitting, leaky catheter, apply the wrap using the instructions that reflect your patient's anatomy. All residual urine will be captured. If you have any additional questions on the quick change wrap and how it can be more effective for your usage, you can find us at our website, QuickChange.com, where we have several videos on the wraps as well as various materials and instruction guides for downloading. We also offer virtual in-servicing live from our broadcast studio over platforms such as Zoom and Skype, where you and your team can interact with our clinical educators. Feel free to call us anytime at 1-800-206-2816, where we can walk you through any situation.